Thank you for sharing your work and your perspective. You mentioned sort of the physical barriers to people being fully included in their communities, mentioning that homes are not always accessible. Is there any work being done to reduce some of those physical barriers to people's full participation?
Yes, I'm glad that there's some considerable work going on, but I'm afraid it's not enough. One of the things that happened in 2017 was the Indian Parliament passing a law making it mandatory for public establishments to be barrier free, but that at the moment remains a paper tiger. There is no clear plan of action for its implementation. So I have working with me, my executive assistant is also an activist. She is a quadriplegic, her name is Ashla. She has been spearheading a movement from our side, and there are many activists in the country trying to advocate for this. But that is not convenient again for the engineers, for the government. It's easier to ignore them. So there is considerable advocacy needed there. We get together with international agencies, and the person that I mentioned just now was in California 2 weeks back, having discussions with B.J. Miller, whom you might have heard about, and another activist there, and trying to develop a strategy. But you seem to be interested in that, and I would certainly would like to leave my contact with you and be in touch, so that that group working in the country needs a lot of support.
Thank you again. Medicine used to be a calling, and now it's a job. And I think I'm speaking for North America now. In India, I think there's a much stronger, cohesive family unit that can support some of the kinds of things that are important to palliative patients. But in North America, I don't think that exists nearly to the same degree. So how do you feel that cultural shift that needs to take place in terms of focus, both in the medical profession so that patients become more important than a 4 o'clock tee-off time, and so that people get more joy out of treating people and making their lives better? How do you think that cultural shift can take place?
If I may talk about two different aspects of the issue. One, about the family unit and its strength. Unfortunately, one negative aspect of our global development is urbanization and globalization. Young people going away to find jobs elsewhere is a reality. I don't see it changing, and I have no idea about, I don't know enough of that science of sociology or anthropology to find an answer to that. So that's a reality, and the answer to that can only be further strengthening of local communities, even if not necessarily related by blood, purely bonded by love and affection. That kind of building of communities, I believe, is still possible. But there is another big question there, and for which I look to you all for possible answers. When I talk to medical students, I don't know, even in this country, not in Canada, but in USA, I spoke at several universities. Young doctors and medical students and nursing students are not very clear about what their function is. They still, if asked, they do not say, our duty is to relieve suffering. They do not say our duty is to improve quality of life. They are confused. I think there needs to be a concerted effort at one global statement where the healthcare system accepts that while treating diseases, they also have a duty to address serious health-related suffering. There was a Lancet Commission report that came out in 2017 October, which talks about serious health-related suffering as the possible focus of healthcare, which identifies that 60-odd million people all over the globe are in unrelieved serious health-related suffering. So what will we do to make the World Health Organization and all bodies and all textbooks of medicine and nursing to proclaim that the healthcare professional has a duty, primary duty, to address health-related suffering? Can that change happen? What do we do to make that happen? A lot of people talking about it, on social media, tweeting about it, forcing somebody to address the issue. A global commission to look at serious health-related suffering and to develop a strategy for addressing it. I'm not sure, but I do know that that revolution is necessary.
Anyone else? Thanks.
Thank you so much to you and your wife.
Thank you,
to the wonderful gift that you are to the whole world. And I'm really touched today and last night by how much you see the dignity of the person. We're not just human doings, we're human beings first. And you're able to connect and help people experience that it's good that they exist, and so they can find hope in their situation. So just want to thank you for that.
Thank you, Cecilia. Thank you. And your eyes filled, and that's a gift to the world. That's the compassion that you are giving out to the world. Thank you for that.
Anyone else? I'll just get the mic.
I hope some of the comments also will bring out more ideas about that change in focus of the healthcare system towards suffering.
Thank you very much. I surely can't talk the last comment and the emotions that speak, but I'm a researcher primarily, and I work with clinician researchers, patients, and government officials in trying to bring research evidence to change the system. But I'm particularly impressed with the way you have mobilized the volunteer power amongst our communities. We try to do that here, and I think what we have done is quite different from your approach, and I'd like to hear a couple of words about what we go with organizations that are there and they have volunteers and work with them. I'm doing a project that didn't go that way, and I'm looking at former patients in cancer to become volunteers helping the new patients in cancer. So but it's still a sort of North American model. But I heard you say you are going and working with college students and retired people, and the way you explain that to the point of creating their own organization eventually as the groups. But that takes enormous amounts of perseverance, dedication, and actually quite a bit of groundwork to get to that point. If you could just tell us how you actually mobilize that kind of power, I would be really delighted to hear your thoughts about it.
Thank you. I agree that it takes a lot of effort, but I must also tell you that to build a community group requires less effort than installing an MRI machine. It does take time, it does take effort, but not unachievable amount of time. If we decide that our time is well spent trying to build that, and that group may eventually make more difference than that additional MRI machine. I'm not underplaying the value of technology, but I am trying to say that sometimes we should set our priorities. Once we consider it important, maybe there will be ways, but we need to be cautious. There are several issues there. I would be happy to share with you a paper on social capital, that a publication from USA that I have seen, and they caution against some of the negatives there. And I have seen some of this happening in Kerala. Palliative care with the volunteer participation has become so popular that people see opportunities. Now vested interests will come in. One, political. Actually in Kerala, a political party has declared palliative care as their agenda. And they are training their own party members as volunteers. That's great. That can be fantastic if their primary objective is the welfare of the patient. But if their primary objective is growth of the party, then maybe that will become a part of the problem and not a solution. Similarly, religious fundamentalist views, they come in. I have seen that happen, because very often we work with all three major religions in Kerala. Palliative care organizations are there in Hindu, Christian and Muslim groups, and most of them do fantastic jobs. None confines their service only to people of their religion. They don't discriminate, they give care to everybody. But there are a few who have fundamentalist ideas and want to inflict this, push that down people's throats. And somehow, if they can convert somebody in the last week of life, they consider their job well spent, not considering the amount of social suffering that causes even within that person. Sometimes it gives them peace, but sometimes it causes great conflict. And I have seen that personally. So these vested interests will come in. That's one. Secondly, you are encouraging them to come even to the hospitals. We are. Into our establishment, they are welcome to. They are not welcome to the corporate hospitals. People are saying, come, let us help. And the hospital says no, because they are not convenient. They will ask questions. They will be the patient's advocates. You can't make them mute. They have the passion in them. They will be advocates, and that can be inconvenient. So these things we'll have to take into consideration. Some ground rules will have to be accepted. Those who are not willing to go by the ground rules cannot become part of the system. But it takes effort, I agree. Can I take that question, or is that?
All right, one more question. Sorry, where was this?
I just wanted to comment on your question about how do we globally get together to encourage relief of suffering. So I think the relief of suffering, the obstacles, the function of economics, the financial model of the healthcare system in Canada does not allow for the time that is required to address the issues related to suffering. And so using social capital harnesses that time from the community, which is valuable, a very, very valuable resource. And it's the time that is required to start addressing suffering.
Thank you, thank you. I mean, building that, making that economic model and presenting it as a case, I suppose can be valuable. Thank you.
I'm sorry, but we're going to have to draw this session to a close. We are on a limited time so that Dr. Rajagopal and Chandrika can head off. But I thank you both for being here with us for the past, well, in BC for the past few days. And it truly has been our privilege to hear about the work that you're doing in India, to be inspired by it. And I think the evidence is here that you've touched on the deep sense we all have of compassion for another human being and how that can be used to make life better for all of those who are living with a serious illness and at the end of their lives. So thank you so much for being with us.